This will be our final question. It comes to us from reader Kristen Nielsen of Chicopee, a retired nurse, and it concerns the recent layoffs at Baystate Medical Center, which is a cornerstone employer in Western Massachusetts. The question is, what is your plan to help Baystate bounce back from a bad year? How can the state ensure a more regionally equitable healthcare coverage plan? Eric, you can start.
Great. Now, it's a very, very important issue. One of the most important challenges we face, frankly, for a few reasons. One, Baystate employs 14,000 people in Western Massachusetts. It's by far the largest employer in our region. It would be devastating for our communities if something were to happen to that. Second element of it is it's the only level 1 trauma facility in all of Western New England. So if something happened to Baystate, it would be a critical loss of access to health care for our communities. People would either have to go to Hartford, or they'd have to go to Worcester, or they'd have to go all the way to Vermont to get the kind of access to the quality care, or to Albany, to the type of care that Baystate provides. So it's important for people watching to understand there's really two things happening right now that's creating the challenges for Baystate. First is there is a structural unfairness that we need to fix, which is that the way private insurance reimbursement rates operate, someone gets a heart transplant or a broken bone, for example, or some type of medical procedure in Springfield, the insurance company reimburses Baystate one price. The exact same procedure, the exact same injury, someone walks into a hospital in Eastern Massachusetts, for example, Mass General or one of the teaching hospitals there, the exact same treatment is billed at a higher rate. So what that means is that we're getting paid less for doing the exact same work here as hospitals in Eastern Massachusetts. That is outrage. People should be outraged by that, and it's something that we need to work on to close the gap. The second item that we have is an increasing portion of Baystate's patient population is what's called public payer. What that means is folks who are either on Mass Health or are on Medicare. Unfortunately, those programs, Mass Health and Medicare, pay a lower rate of reimbursement to the providers than private insurance does. And as the portion of patients who receive Mass Health or Medicare goes up and up for Baystate, that means, unfortunately, that their reimbursement rates go down and down. So it's important for people to understand this is a very significant issue. These are very important and very significant structural problems without how healthcare is operating in our state and in our country right now. So what we did is we put a team together, our Western Mass delegation, and we went and we asked for $5 million in funding to help bridge this gap and to help begin to create equity between Baystate and the other hospitals in the rest of the state. Unfortunately, we encountered significant resistance. Most of the resistance, as you can imagine, was from hospitals in the eastern part of the state that benefit greatly from this disparity. So we have a battle in front of us, actually, to make sure that this gets fixed, and we have a battle to make sure that Baystate gets the support it needs. I'm 100% committed to this. I come from a family of medical providers. Every member of my family, in fact, aside from me, is in the healthcare field, so I understand these issues innately and at my core how important they are. And the important thing about it, it's going to require essential collaboration between our delegation here in Western Mass, our Eastern Mass colleagues, and very importantly, partners at the federal level who can advocate for the federal funding formula changes that are an essential part of what's causing the troubles for Baystate.
Thank you, Senator Lester. Mr. Harrington?
Yeah, Baystate, my wife works at Baystate and has for many years, and Baystate provides a great service to everybody in this area. But as I understand it, again, the state government is involved in this, where the reimbursement that they recently were getting because of Medicare and Medicaid rates goes by the smallest hospital within the state. And there was some type of an accounting error where Baystate and all the other hospitals had to pay back millions of dollars because there was some type of an accounting error at the smallest hospital in the state. That seemed, when I first heard that, it seemed a bit crazy to me, but that is the system that the state requires them under to do it. And that has triggered so many of these layoffs that are dealing with right now. As you know, Eric had mentioned before, there are too many people who are not insured who are going to Baystate for very simple procedures. And we've had Well, we've had reform when it comes to our health insurance industry, not only in the state but the country, but it still leads people who are not insured walking into the emergency room looking for services. And as Baystate is, in all hospitals, they can't turn anybody away. They must take care of them. So it's a huge drain when those people are walking in and getting services because they're not insured, and Baystate's eating the cost mostly for those things, which triggers everything else. As a state senator, I'm certainly going to be working with our officials here at Baystate Medical, but more work needs to be done on the state level, and Governor Baker has endorsed my campaign, and he understands this issue very, very well because this is the kind of industry he came from. He has some plans in place that are going to benefit places like Baystate Medical and all of our local hospitals because they are one of the biggest employers in this district. We need to make sure that they're getting by and they're also providing great care as they continue to do. But I'm looking forward to working with Governor Baker on this issue to make sure it gets fixed.